now when I'm 15, I won't get my lung cancer until I'm 50. So yes, smoking causes lung cancer, but it's not going to kill me today. The epigenetic story is even more a daunting story, and I'm going to let Mike summarize that. But what we've learned is that the idea of toxicity that the EPA uses is entirely inappropriate when it comes to our reproductive outcomes. When we're forming babies in the womb, we're actually forming an imprint of DNA that would set the stage for the rest of your life. And when this imprint is altered by the exposure to these products, then not only is your disease risk changed for the rest of your life, but as Mike Skinner will show you, it may alter the lives of all of your descendants. So I'll let him tell that story, and I'll let Dr. Ho tell her story. But this list of things on the right-hand side here are the various insults or exposures that we now have to worry about during pregnancy and conception. All of these have now been shown to be capable of imprinting DNA, which means they are potentially capable of altering our adult life in the spectrum of risk of disease and altering our descendants' lives. I was thinking of inherit the wind here, but it really should be inherit the wheat killer. So are we healthier? Well, indeed, the cure rates are up, but diseases are up. We're doing better taking care of premature babies than ever. I'd love to brag about it, but premature rates are up. Autism rates are up. Male birth defects are up. Asthma, cancer, infertility is up. The only thing that's down are sperm counts. So yes, we're getting better at saving people with cancer. I noticed that this university, like every other community in America, is building a Taj Mahal to cancer. And in a neighborhood near you, you will find a heart center with valet parking, a maternal fetal medicine center for high-risk pregnancies, and a reproductive endocrinology center to help women get pregnant who are no longer capable. Cancer in children, rates are up. Asthma, Dr. Ho is going to talk about perhaps why. And cancer in children, now we can relate to whether they live near croplands. Obesity rates, attention deficit disorder, learning disabilities, major depression, premature menarche. This is the obesity story in the U.S., where blue is good and red was bad. We already knew that. But autism not only increasing the incidence of diagnosis, but the younger ages are making the diagnosis. Major depression. We're talking about this from my perspective. Every pregnant mother now comes to me already on an antidepressant. When did that start? The use of psychotropic drugs my wife works in a school system as a nurse. Everybody, you have to be a pharmacist now to take care of the kids in ordinary school. Child neglect and abuse, I'm going to come back to this, but one of the most frightening aspects of fetal exposure in women to drugs that are hormonally active is it makes them less good mothers when they die. This has been shown now in animal models, and it would predict, if it were true in humans, that we're having more abusive neglect. Now here's one that you can't fake, age of menarche. The long-term trend for age of menarche is shown in the upper slide. This goes all the way back to 1860. But this is the American experience, where girls less than 11 years old are menstruating. So actually, when you look at the more important slide, you could have said raging hormones at an incredibly early age. Prostate cancer rates are epidemic. Breast cancer rates are epidemic worldwide. Even in countries with low rates of breast cancer rates are up. Global increase in diabetes, the same story. The lowest rate of diabetes in Africa, but it's the highest rate of increase in diabetes. Diabetes rate is not just increasing, but the age of onset is decreasing. So when I was practicing in New Hampshire, I was seeing 2-year-olds starting on insulin. Diabetes has been linked to pesticide levels, and these are the individual pesticides and the increased odds ratio of having diabetes versus DDT, and many other current use pesticides. Diabetes has effects on the adult, but it also has effects on pregnancy that affects me. I just admitted a baby to look just like this. We call them Buddha babies. The mother had diabetes with too much sugar on board. The baby becomes very obese, but the baby's risk of birth defects of any kind is increased 2 to 4-fold. Increased risk of immaturity, increased risk of jaundice, increased risk of poor feeding, and temperature instability and low blood sugar. I didn't mention that perhaps lifetime risk of diabetes has now been altered. And these are some of the other LBGYN diseases that are on the increase that have all now been linked to environmental contaminants, and Dr. Warren mentioned polycystic ovarian disease. There isn't a woman here that doesn't have a friend that has that disease. When did that start? And here's the risk of pregnancy-induced hypertension. I didn't bring this graph with me, but this is an example of correlating a disease that is now increasing in incidence, causing premature babies, that is linked to how closely exposed to pesticides you are. So my trouble in paradise really began with looking at babies in my nursery and asking about birth defects. And what I found were two things. I found that my state and 12 other states in 2001 weren't counting birth defects. Now, I happen to know that birth defects, by the CDC's reckoning, is the leading cause of infant death in the United States. The leading industrial country in the world wasn't counting the leading cause of infant death in a quarter of its states in 2001. Now, I like to ask the question, what wasn't just said to me? And what was just said to me was, we've never had a woman president. How would the leading cause of infant death in the U.S. not be counted? But the other half of that was that we learned about the contamination rate in the water in our state and eventually the entire United States. But this is one example of a contaminant that's caused by disinfectant byproducts. Like every other contaminant we've studied, it seems to peak in June. This is the contaminant level, and when I asked my EPA in Indiana to tell me how frequent, just to send me the information, I calculated the rate of sampling by the water companies, and that's shown in pink. This slide almost made me want to throw up, because I realized that we have the EPA and the water companies allowing each other to not measure in the most contaminated month. So we said, well, they're not counting the birth defects, we're not measuring the water in June, I can't go wrong at least looking. And so we went looking. Now it's relevant that we had met Tyrone Hayes at this point, and we live in the corn belt, which is where corn is born. This also could have just been redrawn as the atrazine belt, because this is the atrazine story. And this, you know, knowing what Tyrone has shown, that you're more likely to have eggs in your germ-containing organs if you're a frog getting exposed to atrazine. This means that an estrogen effect could be affecting children, or at least we should be. If we live in the corn belt, in the atrazine belt, we should be counting our babies to see if they're normal. And sure enough, we look at atrazine in the water in Indiana, we find that it peaks regularly as the Matterhorn. I call this now the June effect. But it was a fairly simple thing to use to ask the simple question. This is the peak concentration of atrazine in the water, and we can simply collect all the birth certificates from Indiana which contain birth defect information, which our state health department wasn't using, and I asked if I could borrow it. And to make this story a little shorter, I'm sorry, I'm running out of time here, but we found that birth defects like spina bifida peaked in June, abdominal wall defects peaked in June, and we found premature birth peaked in June, sudden infant death peaked in June, male malformed genitals peaked in June, and that while we weren't counting spina bifida in Indiana, we exceeded the national average for the entire time period. So a state that was not having a problem with birth defects wasn't counting them. In our national study, we found the national water looks the same, and so all of the birth defects for the whole U.S. increase in women who conceive in the time of highest